everyone, my name is Alisa. Currently, I work for WHO Thailand as the National Professional Officer in Health Emergency. So, today we will talk about disaster and mass casualty incident. In this session, we will talk about disaster and how it is related to health or health system. What is mass casualty incident or MCI, and what are system approach to manage such a large number of patients, and how health facilities prepare for such incident. So first thing first, what is a disaster? There are many definitions on this defined by United Nations Office for Disaster Risk Reduction, International Federation for Red Cross, or Wikipedia or Cambridge Dictionary. They all have minor difference, but the key meaning are the same. So it is a serious disruption of the functioning of society at any scale, leading to human loss, material loss, economic, and environmental loss. So Sendai framework is a global framework on disaster risk reduction. There are terms mentioned in the framework which I think it is good for us to understand the nature and type of disaster. Small-scale disaster defines as an incident that affected the local community. Large-scale disaster required national response and international assistance. Slow onset disaster, such as drought, haze, desertification, are an incident that emerge gradually. And sudden onset disaster, which everyone is familiar with, is the incident that is unexpected and suddenly affect the population. There are many types of disaster. The most common one is flood. It is likely to have more flood in the future because of the climate change. Flood has health impact. Directly is drowning, but also coming with the dirty water is the skin and tissue infection. And with dirty water also come with vector-borne disease and any infectious disease that could occur due to the lack of the clean water and the poor sanitation, such as the diarrhea or zoonotic disease. For storm and landslide, they have very high mortality, and the common cause of death is trauma and suffocation. The next example of disaster is tsunami. Cause of death is drowning and crush injuries, and the wound from tsunami is usually considered a dirty wound, which usually requires an aggressive wound cleaning, antibiotics, and surgical intervention. Mass shooting is not natural disaster, but it can be considered as a man-made disaster, and the number of casualties may be small or large, but it has a widespread psychological impact. That is why we should raise awareness and have early psychological intervention to the affected population. And media management play very important roles in this incident. Fire incident, it is straightforward that it is expected that we will have the burn and inhalation injury from smoke victim when we have a fire incident. Stampede or crowd crush could occur when there are lots of people gathering around in the same area, such as a concert, sports stadium, carnival, and the risk of death is from compressive asphyxia, or victims are not able to breathe due to the external compression. So, when planning for this event, we should also have the evacuation plan to prevent this kind of the incident to occur. Drought and heat wave. The impact of these incidents include shortage of drinking water, poor quality of water which affect the public sanitation and hygiene. Pollution or haze or PM2.5, many times it's seasonal and it has the short-term and long-term impact on health including nasal or eye irritation, or patient who exposed for this for a long time could develop the respiratory disease such as asthma, or some may have even cancer. This picture showing the overall impact area by disaster. And when we can define each zone, we can predict its consequence includes the destruction, injury, and behavior of people within each zone. In overall, disaster can impact all levels of health, individual health, public health, health system, and infrastructure. That is why we should have the preparedness plan. And even it is health issue or health preparedness for disaster, but it should not be only done by health sector, but the community should participate in prevention and preparedness activities. So next we will talk about mass casualty incident or MCI. So what is MCI? So it is an event that number of patients exceed the amount of health resources. Hospital is overwhelmed by the number of cases, and this is the reason why we have to set priority on who should get treatment first, who can be wait and receive the treatment later. And the process of mass casualty management starts pre-hospitally at the scene until the patient gets definitive treatment or referred to the appropriate care. The management system we use to approach emergency situation is called Incident Management System. It has a common organizational structure to assist the situation and resource management during emergency response. The incident commander is the leader or the person who is responsible for all the situation. For example, for COVID-19 situation, the national commander is a prime minister. And for the Health Emergency Operations Center, the permanent secretary of the Ministry of Public Health is the incident commander. There are many functions to support commander's work, such as Public Information Officer, who would advise the incident commander on information dissemination and dealing with press, a Safety Officer, a Liaison Officer. The key function to respond in emergency include operation function, which has direct tactical response action to achieve the goal of saving life. Planning, logistics, and finance are function area to support the operation section. These are the key roles and responsibilities for each function under the incident management system. So coming back to mass casualty management, as I mentioned before that the management starts pre-hospitally, this picture is an example of the on-site area management of the chemical fire incident. We can see that we have to manage the area by defining restricted area, evacuation route, zoning for media and VIP, area for triage. Also have to set the area based on the wind direction as well. To manage the area has to be upwind for safety of the patient and staff. Any incident involved with hazardous material. The special consideration on this incident is the decontamination area, which is the area for victims to remove hazardous or non-hazardous contaminants from the person. They will have to take off their clothes, take a shower before entering the cold zone or the safe zone. Next, I would like to explain about the triage, which is a key process of the management of mass casualty incident. Triage meaning sort or group. In mass casualty management, it is very important to identify the group of priority. So which patient should receive the treatment first? So in general, we sort the victim into 4 categories. Red is the most emergent group because they are at risk of losing life, losing their limb or organ function. The yellow group is an urgent group. They do need treatment, but those interventions could be delayed. For example of the yellow group include the broken bones, open wound without aggressive bleeding. The next group is the green tag or the green patients. They are non-urgent group. They can wait longer. The last one is the black group or expectant. They are the group that consider expired or the victim's condition is so severe while the hospital have limited resource, so there is no further treatment. Staff should consider their treatment if additional resources are available. This is an example of a triage tag. So after we conduct the triage, we put the wristband of the color to the patient wrist so the other staff can identify which area this patient should be assigned to. And the triage process can be done few times. The primary triage is performed when the first encounter with the patient on scene. The second triage is a re-evaluation of the primary triage after additional assessment could be done in the safe zone or at the hospital. And the tertiary triage or the third triage could be performed during an ongoing definitive care. Now I would like to talk about hospital preparedness and response in the emergency situation. This table shows that each hazard or threat has a different type of injury or illness. Each health facility should conduct a risk assessment of its own context. For example, if the hospital locates in the industrial area and near the highway, this hospital would have risk for chemical spill incident and motor vehicle collision. So they should train their staff and prepare their space to take care of the burn patient, respiratory patient, and contamination wound, as well as the trauma like blunt injury, penetrating injury, and crush injury from the car accident. Hospital should assign area and patient flows, including triage zone, red, yellow, green, and black zone. So once when the incident occurs, one thing that hospital staff want to know is how many patients are coming or are expecting. So we would be able to search capacity, call for help, and prepare for more resource. The number of cases can be approximated by the dual wave phenomenon. These describe nature of victim arrival at the hospital. First wave are usually mild cases because they could come to the hospital quickly by their own. No need for extrication. The second wave are usually more severe cases. it takes them longer to arrive to health facility because they might need the emergency medical service, transportation, or some extrication. The total expected casualty can be estimated by the number of the case arriving in the first hour times by 2. And one thing to keep in mind is that the pediatric cases of kids are up to 10 to 20% of the total number of cases. And usually the hospital should have isolated area for this group of patients, considering they are vulnerable group. This table shows areas to be activated at health facilities when the MCI occurred. First area is the Hospital Incident Command Post. Next is Emergency Room. Then is Operating Theater, ICU, Human Resource Room, and the other area to be activated such as is the rest area for staff, press room, relative or counseling or contact tracing room, and security area to control the crowd, control the traffic, and coordinated activities with the police. So when hospital plans for mass casualty incident, we have to consider aspects of arrival time, space, staff, and medical supply. In this session, I would only share the example of the space planning. For red zone, it should be a fully equipped area in order to save life to do the resuscitation of the patient. This area must have oxygen pipe, suction, monitor, and those life-saving equipment. For the yellow tag, the area should also have space for the specific intervention such as the fracture splinting, wound dressing, and others. Green zone could be assigned at the outpatient clinic or ambulatory care. There are also potential need for oxygen and assessment equipment as well. Green tag patients usually can be discharged home. For the black tag, as mentioned earlier, spaces for this area should be planned in a respectful way. If possible, it should have the lighting control and bedside chair for family members. So everyone, this is my last slide. I just want to conclude what we have talked about today. We talk about the definition of disaster. It is a situation when needs exceed resource. And the health consequence or impact of disaster include individual health impact, public health impact, and health system disruption. And the mass casualty management start from on-scene referral system until at the hospital care. The incident management system key functions include public health information officer, liaison function, safety officer, finance and admin, logistic, operation and planning. And in mass casualty management, a triage is an important process to prioritize patients for treatment and resource management. We usually categorize patients into 4 groups: red, yellow, green, and black. And hospital preparedness for MCI should include the timing, space, staffing, and supply. So if you have any question, please feel free to send me an email. I really believe that this course is very useful for our future preparedness, especially when the young generation participated in disaster risk reduction activities. I wish you all to have a great day and enjoy the course. Thank you so much.